I won't try to keep you long because I'm sure you probably wish you didn't attend this meeting so you could go home. But what we're here to do today, first of all, I'm Lynn Spencer from the broker's office, and basically, if you don't know what we do for you, we try to be the go-between yourselves and group administrators. If you have any kind of claim issues or having any type of trouble, you can give our office a call, and that's what we're there to do to help you. Also, we're here to help the school with any type of issues with their plan and to also try to help costs. So basically, it is what it always is every year. Healthcare costs are always rising, and so what we try to do is get with the school and try to help them to cut those costs and also try to improve your health plan. So what we've done for 2012 is brought this medical concierge program to try to do both of those things. The name of the medical concierge program is called the Keysel Care Management, and you can see up there how that is spelled. So what I want to do is first of all tell you what is the medical concierge. Basically, just as it says up on the screen, it is designed to provide information to the employee and the dependent that are on the group health plan in need of non-emergency. Make sure you understand that this is not developed that if you're in an emergency situation that you need to call them, so it is a non-emergency. In a medical procedures that to help them decide on a facility, it is facility oriented, it is not designed to be working on the provider or to direct you to a different physician, I should say. Not the it is for facility only, for high quality care and most cost effectiveness. I like to compare it to like if you're out of town and you're at a hotel, you would go up to the concierge or the front desk and you would say, can you please direct me to the best restaurant with the best cost in town? That's basically what they do when it comes to medical care. So they do procedures can be inpatient or outpatient, as simple as an MRI or a transplant. So they deal with all type of procedures. You've been given a list on different types, and we'll go over that a little later in the presentation. The goal is quality of care, along with providing meaningful and easy to understand information relative to the cost of the procedures. They'll be providing you reporting on the facilities, and again, there's a sheet that you've been handed that shows an idea of what those reports look like, and we'll go over that a little bit later as well. Employees save money as their out-of-pocket costs are reduced. Basically, when they start out, if you have a procedure, let's say you're going for a colonoscopy and a doctor sets you up at a hospital. If that cost is $1,800 and they redirect you for the same doctor is doing it, but maybe they redirect you to a surgical center, and that cost is $800, well obviously if your starting cost is now not $1,800 but it's $800, you're going to save money up front. Now the plan saves money as well. Basically same principle. Your starting cost is going to be less, they're going to save money. Now some people might sit there and say, well, if I'm going for an open heart surgery and my cost is $25,000, $50,000, why do I care? I'm going to meet my out-of-pocket costs anyway. Well, you know what? You actually really should care because the plan, your school pays for these claims. And if the school is paying more money for things that they don't need to pay more money for, it's ultimately going to affect you. You know, your cost is going to go up, your claims are going to go up, cost is going to affect you, and it's going to hit your pocket when we have to tell you that there's been an increase and that your premiums have gone up. So it's really important for us all to be consumers on this. Again, more on the why the medical concierge. The quality of hospital care can vary. You don't have access to this information, but a Keysel does. And we'll show you as we go through the presentation how they get that information. Hospital charges vary substantially to identical procedures. You can go to the hospitals in the two hospitals in the same town for the same procedures, and the prices can vary with that. A Keysel can find that information out for you. I'll give you an example. You could be going in for knee surgery, and your provider can be a participating provider at, let's just say, Goshen and also Elkhart. And the nurse may say to you, well, okay, what day is best for you, Tuesday or Thursday? And you'll say, well, I don't know, Thursday's a better day for me. Well, just by choosing Thursday, you may be set up at Goshen Hospital, and that hospital may be $3,000, $10,000 more than Elkhart maybe, and you're going to have the same doctor, the same procedure, and it's going to cost you more money. And you may not get that information, but Akiso has that information, and they'll be able to tell you that. So there again, there's a way of saving money. And again, patients don't have access to this type of information. Medical concierge service can help you make informed decisions as to where to have inpatient or outpatient procedures performed. And again, we've seen a lot of savings in this area. We have other clients with this program in place that we put in, and we're seeing a lot of savings come through. And a lot of that is because of moving a lot of procedures from hospital settings to a standalone surgical center or imaging center for x-rays if you're sent to the hospital for an MRI versus maybe going to a standalone imaging center. And that's where we're seeing a lot of the savings come through. Services you need to call medical concierge services on. This is a pretty good solid list of what you can refer to call them for. Another thing that we have changed is you're going to be calling the same number for pre-certification. It's different now. All your inpatient services you will call for pre-certification. I am here to tell you that even though your provider, your hospital will tell you that don't worry, I'll take care of the pre-certification for you, ultimately it is your responsibility to make sure that pre-certification gets done. I think you all know if you looked at your summary of benefits that you are penalized if you don't make that call. So in the long run, it is your responsibility and you should always make that call to make sure it gets done. What's nice about what we've done here is the school has decided to let Akiso do both of that, so it's going to be seamless for you. So if you call Akiso for the pre-certification or just call them for the medical concierge service, they'll be able to transfer your call within their company to make sure that both of those get done at the same time. Outpatient services that require the medical concierge, here's a list of things that you can reference to. If you're ever in doubt, we always say give them a call anyway. They're very, very friendly. They'll talk you through it. They'll say, well, you know, you really didn't need to call us, but let's make note of this in case something else comes along the line. For instance, if you would call them, sometimes if you call like if you're going in for physical therapy, say on your knee again, and they'll make record of it because you never know, maybe you're having the physical therapy and then eventually you may have to have, unfortunately, have knee surgery. Well, then they'll have record of that, then you can call back, and then they'll work with you on where to go for that knee surgery. Things that you do not need to call medical concierge service on are what's listed up here. Simple x-rays, I like to kind of say, or maybe, you know, if you fractured your hand or your foot. A more complex x-ray would be, again, referencing maybe a knee surgery. And an example I like to throw out there is Associate Mike Stanberg, maybe some of you know him, he's done a lot of presentations. He had to have knee surgery done, and he had x-ray of his knee done, and the imaging that had to be done on that, it was a special type of image that had to be done, and there weren't any facilities in this area other than the hospital that could do that. And Akiso looked it up for him and found an area, a place in Fort Wayne that could do that. And so he actually drove to Fort Wayne. He actually saved thousands of dollars by going there versus staying here. One of the things that you did not see on the list that I've been asked by some of the ladies is mammograms. Mammograms are not something that you have to call on. It is something that you can call on if you like to, but it's not a requirement that you have to. Medical concierge service process. As soon as you find out you need a medical test procedure, you are supposed to call the medical concierge. Again, in doubt, you need to give them a call. The final choice of the facility is entirely up to you. There is a penalty, like the pre-certification of $250 to give them a call. The reason for this is because this service does cost the school money to have this program in place. So they had to put some skin in the game to make sure that we are using this service. If we don't use it, we're not going to see any savings. You're not going to see savings, and the school isn't going to see any savings. So again, I'm going to repeat that. There is a cost to you if you do not make the call to the medical concierge service. But if you call them and say, hey, I'm going to have this surgery. This is where my doctor wants me to have it done, or this is where I'm supposed to have this colonoscopy done. And this is where my doctor wants me, has suggested that I go. And they look it up and they say, well, we have these other suggestions. And if you go here, you're going to save $1,000, and you say, well, you know what, I think I'm just going to do what my doctor recommended. You're fine. They'll say, fine, we'll record that. You don't have to do anything more. If you choose to go with them, then you will continue down that path with what they want you to do, and continue on. So when you call the medical concierge service, I'll talk the door.
Sorry.
That's okay.
Can you repeat what you said again?
Sure.
About if you choose to have it done with a certain doctor,
Right.
even if it's recommended you go somewhere else?
Right. If your doctor wants you to have a colonoscopy and he says, you know, I want you to go to this facility, and you call the medical concierge and you say, I'm scheduled to go for a colonoscopy, my doctor wants me to go to Elkhart General. And they say, well, okay, well, let's check this out. We're going to review this, and we'll look at some other facilities, and we'll come back to you. So they give you a call back, let's say, if they don't do it right there on the phone. And they give you the different facilities, and you say, well, and they say, well, we can save you $1,000. It's the same doctor, same cost. And you say, well, no, I don't want to do that. And I go, okay, fine. You don't have to. We'll just put it in record it in your file, and you're done. If you choose to do that, then that's where they're going to go into the next step. That's when then they're going to start to request demographic and medical and provider information. Then they're going to contact your provider for the clinical details and admitting privileges. And then they're going to create a user, this is what they're going to do for you once you call them. Then they're going to create this user-friendly report for you in quality and cost of care. This is when you call them and say, this is what I'm going to have done. Okay? If you're not having surgery done, or if you're not having going into the hospital, you may not get this report that you have in front of you. So they may just give you a confirmation number saying that you called. Okay? Then if you choose choose to go back with them, if you call them and say, okay, I've decided that I want to go ahead and do what you'd like for me to do, that's when they're going to say, okay, what provider of choice do you want to go with? Do you want to go with our facility? And if you say yes, then they're going to stay on the line with you, and then they're going to schedule the appointments for you. Then they're going to work with you and get you information. They're very helpful with giving you stuff to say, well, this is what you can ask your doctor about the surgery. They're going to schedule appointments, coordinate the pre-certification, and so forth. They'll negotiate the best rate for you. If it's in or out of network, they'll actually get on the line and try to negotiate rates for you. With competing facilities and try to get the cost down. They'll provide you with education material, as I mentioned before. And I also want to point out to you, as far as the HIPAA, this is all still HIPAA privacy. Your employer does not have any information as far as what you're doing or where you're going or what your medical information is. The only thing your provider gets involved with or what they will see is on a monthly basis, we will be showing them a report that says that there was an MRI, or there was a colonoscopy, or there was a knee surgery directed from a hospital to an imaging center, and this is the amount of money that was saved on a planned basis. They won't know who did what or when or anything like that. Okay? Yeah?
I assume they'll only recommend you to in-network providers, is that correct?
I'm getting to that. So that's a good thing too. Very good question. But I'll go ahead and answer it now. Why will you suspense, right? If they do recommend you to an out-of-network facility, and they feel that that has the best quality of care and cost of care, then group administrators will pay that as in-network. Okay? So that's kind of a nice feature as well. We've set that up with the plan. Okay, so let's talk about this report, if you get it. The first page, the first two pages are basically a visual. That's why it's in the graph form. And the first is the hospital value index. And that basically is showing you the quality of service, and it's showing the affordability, the efficiency of service, and the patient satisfaction in service. And as we go along, I'll kind of tell you how that percentage is broken down. And if you have surgery, then the second part of that is your surgical quality of score. And this is relative to a colonoscopy that was done in 2010. And it's just basically showing some hospitals within the facility, the area. Next page is just showing facility charges and estimated costs. So it's showing what the charges were for that charge to the patient, and then the estimated cost of what it cost those facilities to actually do that procedure. And then below that, then they will tell you what physicians are within network that participate at those facilities. Now, a breakdown of all that number-wise is on the third page. So now you can see what the facilities are, and you can see there that some of those facilities for that colonoscopy were $1,809, some were $1,845, but you could actually get that procedure done for $843. And yet, you could see what the estimated cost was for that facility to actually do that procedure and what their quality of scores were. So a lot of people will say, well, where do you get this type of information? On the next slide, you'll see that I'm just basically going to read it because that really explains it pretty well. ACISO receives this detailed inpatient data on all acute care hospitals in the nation as a result of billed charges and internal cost information that is required to be submitted to Medicare and other organizations. All facilities have to turn this information in. So that's where they get their information, and because they're claims payer, medical provider type, they can get that information that we can't get. And it's based off of 23 million inpatient discharges and 140 million outpatient occurrences. The quality analysis is based off of 65% of that is based off of quality of services. 25% is based off of the affordability and efficiency. And then 10% off of patient satisfaction. Now this next slide is kind of interesting. It's a little hard maybe to read as light as it is in here. These are facilities more in the Carmel area, which is where ACISO is in the Minneapolis area. But this is for a back and neck procedure. And I think it's interesting to kind of note that the charges for this procedure based off of what these facilities what it actually costs them to do the procedure, and then what the hospital profit is. And based off of that, what you can look at, the quality score, and you'll note that the ones that actually charge the most don't always have the highest quality score. So it's not always you pay you get the best quality for the cost, which I think is kind of interesting because you always sometimes think, if I pay more, I'm getting the best. It's not always the case. So what are employees saying about the medical concierge service? I can tell you with the clients that we have this in place with, we are getting some really great success stories. One of our clients, and this is a good success story, but one of our clients' employee had a sinus surgery done within the area, and just by taking it from one facility to the next, there was a planned savings of $32,000. And then there was another employee that was going through a pretty major illness, and they found not only some savings, but just a lot of comfort with dealing with ACISO by calling and talking to them through the process and asking them some recommendations of just about what was going on with their illness and procedures, and just about the providers in the area. So we thought that was very helpful as well. On the next slide, new ID cards. I think some of you may have already received them. They went out on Friday. We thought while you were getting new ID cards with this information, we'd go ahead and get you into the new age and take off those Social Security numbers and get you the new unique ID numbers. And so that has been taken care of. And if you were on the traditional plan, your new cards are tan. You're on high deductible, your new cards are yellow. You need to throw the old ones away. If you switch to the next slide, you'll see what those new ID cards will look like if you haven't received them yet. The pre-certification number, if you look on there, is the same as the medical concierge number. The one thing that is not on here any longer is the one-call medical number, but that service is still available to you. Even though you need to call the medical concierge for MRIs and CTs, there's still going to coordinate that with your one-call medical. However your plan is set up for that service, that is still available to you. But they are going to call the one call and coordinate the call with them and stay on the line and make sure that that gets taken care of for you. So you'll call them. That's why that's not on there anymore. It doesn't mean that you still don't have that service available to you. I have had some people call me and say that if you have the family coverage, you get 2 cards in the mail, but they have students that are out of town and they need more cards. You can either go online and order additional cards, or you can call group administrators and get additional cards, or you can email Carrie Medich, which I have her email address, and I'll tell that to you if you want to write it down. If you need additional cards. I think she's getting innovative with a lot of emails, but that's okay. It is CMEDICH@groupadministrators.com, and just let her know how many additional cards that you need, and she'll make sure that you get those.
Would this service also work with my secondary insurance on my husband's plan?
No, just this plan. Now, one of the questions that was asked earlier was, what do I do if I'm already in the process of something, or I have, procedure going on tomorrow? Because this is a free one. Number one, they're not here to interrupt anything that you've already started. If somebody's in physical therapy, or you're in the process of chemo or anything like that, please continue to do what you're doing. I would recommend that you might give them a call and let them know what process that you're already in, because I think that they could be helpful. And also, for instance, like if you are in physical therapy, and I keep referencing me, I think I'll stay on that subject. If you're doing physical therapy for a knee problem or something like that, that might turn into some type of a surgery, and then that way they'll have record of it, and it can help you as you go through that process. And again, if it's an emergency situation, you don't stop to say, oh, I got a call, and then concierge, and just go to the hospital and do what you need to do. Any questions? Hey, everybody wants to get outside. Yes.
What if we don't call?
If you do not call, then you're penalized with the $250.
Do they bill it? What? Doctor paycheck?
You'll see it on your explanation of benefits. It will come off of your, just like your pre-certification, your $500. It comes off of your charge of where your deductible comes off, and it comes off of your $250 that you will off of your claims box.
Doesn't your administrator negotiate the prices for you?
Our administrator, you mean group administrators?
Yeah.
When you have you automatically have your network discounts that go through, and they do that.
Okay.
And a lot of times, if it's out of network, they'll still try to get further discounts. But Akiso works even farther on that. If they see something as out of network, they'll even discount more. We've already had a situation where we've had an employee that went out of network, and it was going to be paid as in-network, and they've already worked to try to they've already got 15% off of the bill charges for out-of-network as well.
So they can advocate, I guess, further than what?
They can just keep negotiating, yes.
What about general doctor visits, like yearly checkups?
No, if it's just primary care visits, you do not need to call. If you get to where you're getting more in-depth into some type of a maybe specialty type visit, you might want to give them a call and talk through that process.